Thank you for asking me to discuss what I think is an important finding from the GEMINI study. My name is Brian Flowers. I'm a glaucoma specialist at Ophthalmology Associates in Fort Worth and was an investigator in the GEMINI trial, as well as an author on the publication. It should be noted that the OMNI Surgical System is FDA cleared to reduce IOP in adult patients with primary open-angle glaucoma. For those who aren't aware, the GEMINI study was a prospective, multicenter, 12-month study of combined phaco-OMNI in patients with mild to moderate glaucoma. And there are a total of 149 patients enrolled in that study. And we, of course, watched the patients out prior to their intervention. And what we found in the GEMINI study was that the mean IOP was reduced from 23.8 pre-op to 15.6 millimeters of mercury at 1 year. Medications were reduced from 1.8 to 0.4 at 1 year. 84.2% of the patients in this trial achieved a 20% reduction in IOP, and that's a common primary outcome measure in mixed trials. And 80% of the patients were off meds at 1 year as well. So the OMNI system performed admirably in this patient population. And we all know that mean IOP was the primary risk factor for glaucoma progression. But the investigators were curious as to what effect this intervention might have on diurnal fluctuation. So we looked back at the data and defined diurnal fluctuation as the difference between the highest and lowest IOP readings taken on a given day. Interestingly, we found that for the group as a whole, diurnal fluctuation was reduced from 2.8 millimeters of mercury pre-op to 1.8 millimeters of mercury at 1 year. We also found that the reduction in diurnal fluctuation was correlated with the number of medications patients were on preoperatively. So we looked at patients who were on one medication, two medications, or 3 and 4 medications preoperatively and found that those that were on 3 to 4 medications, diurnal fluctuation was reduced from 3.9 millimeters of mercury preoperatively to 1.7 millimeters of mercury postoperatively. So those of us who treat glaucoma are well aware that certain medications and certain interventions do a better job than others at affecting diurnal IOP. I believe this evidence is one more reason to consider surgical intervention, as shown in this OMNI trial, to treat mild to moderate glaucoma.